Two. A very good afternoon and welcome to the session of IVF Treatment Process. We are glad to have Dr. Ramya Mishra among us today to help us understand the topic better. The doctor will discuss the topic briefly and will take us through that in more deeper in the session. So, doctor, you have the stage.
Thanks, Nikita. I welcome you all in this session of Apollo Fertility, where we take different topics every week and we tell about different, conditions you want to know. And this time we have chosen IVF process as the topic. So, as we also discussed last time, so I'll be throwing some light on the process as such, the whole process of IVF or test tube baby technique. So if you have any questions during this show, you can ask me. You can put in the question or comments box, and we will come up with answers, and we will be having an interactive session over that. Let's first of all discuss what is IVF. IVF or in vitro fertilization, as I told you in the earlier episodes also, it's a process in which the egg of the female is fertilized outside her body with the sperm of her husband, and the embryo which we get out of it transferred into the womb of the female. So this process is also known as test tube technique. Before we enter into the process of IVF, there are multiple investigations or tests which we want the couple to undergo, so that we are able to find out any medical disorders if they have, any other complications, any other problems they have, and then after clearing all the things, we proceed for the process. So, what are the tests which are required before we plan a patient for IVF? First of all, we get the simple blood tests done, like their complete blood count, their thyroid status, their blood sugar levels, and their serum prolactin levels, or the all the other infection markers are also taken into consideration. We also subject the patient to process to a test called thalassemia screening, or in some cases we can go for the blood sugar testing for which is done for last 3 months, and that is called HbA1c testing. Once all these major tests are done, we and everything is fine, the ultrasound is done for the patient, and we see the status of her uterus, her ovaries, and any other problems which are persistent there. After clearing out everything, if the endometrium is good, if the egg count is good, and everything is fine, we ask the patient to come on the second day of her cycles, and then we start the process. In the meantime, parallelly, the husband is also subjected to blood tests, in which he also undergoes some basic tests, and the semen analysis as well. The semen analysis is also fine. Then, when we start giving the injections to the female, which are given for a days, like some 10 to 12 days the injections are given, and they have to be taken and in proper compliance with the doctor. And you are you are asked to come for the ultrasound tests also, wherein your growth of the follicles will be monitored. If everything goes well, your hormone levels are within normal limits. In the meantime, the doctor may also ask you to get the your estrogen levels or your progesterone levels, depending upon time to time. And once everything is fine, you will be given a final trigger shot. That trigger shot is basically for the maturation of the oocytes or the eggs from your body. And once the eggs are mature, we will you will be given a short anesthesia, short general anesthesia, where you have to come empty stomach in the morning, and the process will be carried out at a particular duration, at a particular time, which will be told to you, sometime before you are subjected to the process. The anesthetist will examine you, and after that you'll be given the short anesthesia and a minor, a small prick from the vaginal area we give, and the ultrasound guidance, the eggs are taken out from the body. Once the eggs are taken out from the body, then they are sent to the embryologist, and the embryologists then screen those oocytes, whatever we get from the female. After screening and staging of the oocytes, they are subjected to the process of IVF or ICSI. Embryos are formed from them, and the embryos are monitored. They are monitored for the next 3 to 5 days. And depending upon the quality of the embryos we get out of this process, they are either transferred in the female's womb on fifth day or on the third day. That all depends upon the quality of the embryos we get. If your doctor decides to go for a frozen embryo transfer, then you will be asked to follow them up on the respective dates they want you to, and you will not be given the transfer in that cycle, and you will be asked to come the next cycle, where the doctor will prescribe you some medications or without medications, depending upon case to case, and you may go for the process of embryo transfer in that cycle. So if we take in general the duration of the duration which is required for the couple to come to the clinic, then that's specifically the first part. Like I told you, we have two major parts of the IVF process. First part is the embryo preparation phase. So that embryo preparation phase will take nearly 15 to 18 days. And if your transfer is done in a fresh cycle, then obviously that part is over, and after 10 to 15 days you may be asked to go for a blood test where the pregnancy result will be there, and if it is a positive pregnancy, you have to further follow up with your doctor. But in case we want to go for a frozen transfer, in that case the process may be, the another that once the embryos are frozen, you have to wait for the next cycle, and in that case the process may take another, you can say, 20 to 25 days for the embryo transfer to happen. So this is a major core IVF process, which is definitely giving good results these days. And if you have any of the problems, like in the earlier episodes also, we have told about the reasons why we need to go for IVF. So if you have blocked tubes, if your egg quality is not good, or your husband's semen analysis report is not good, in those cases you need to go for either the process of IVF or for the process of ICSI. If you know that you're not able to conceive at the right time, then you should seek advice from your fertility expert, and you should move ahead in this direction.
Doctor, I just came across one thing, one question, like, in the previous sessions also, like, you were talking about
Nikita,
how women,
your voice is breaking, Nikita.
is it better? So, in the
I'm not
previous
able to.
session, in the previous sessions we have been discussing about how a person decides an IVF. If you talk about a young couple who has been reckless with their uh, you know the health, and they're reckless with the daily to daily, what they're eating, what they're having, what they're drinking, sometimes all these things factors also affect your fertility cycle. So if a couple decides to go on a detox, on a have a a clean, just to for a better conceiving chances, is it possible that the quality of the eggs in, like, can get little better if you have a better, for even IVF,
Yes, of course, of course. See, the egg quality and the quality both have to do with the lifestyle we are following. As I told earlier, also, yes, your lifestyle definitely affects the quality of the oocytes and the quality of the semen in your body. Because when you are taking junk food, you're going for smoking, you're going for drinking, you are not following a healthy routine lifestyle, you're not exercising, then your body tends to have a lot of free radicals into them, and those free radicals are responsible for the process of aging. And as we all know, it's a time proven thing that aging is the process which is the most important factor, which affects the quality of oocytes. So if a patient comes to us at 30 years of age and a patient comes to us at 42 years of age, then obviously the difference in the age has to do with the quality of the oocytes they have. So if you're following a healthy lifestyle, as in the routine activities, you are not going for late night movies or parties, or you're not following those junk foods, whatever we are getting these days. So yes, of course your quality of the eggs and your sperm quality will be definitely good. So there is no question on that. There's definitely no question on that.
Also, ma'am, I was just listening to one of our sessions, and we are talking about miscarriages, like, couples who have had miscarriages, like one or two miscarriages before. So, is there any like a point where if they go decide to go for IVF,
Nikita, your voice is completely breaking. I'm not able to decipher what you want to ask.
I'm asking that, if a couple has had miscarriages in the past, you know, so all these factors,
Miscarriages?
miscarriages, yeah, miscarriage in
Yes,
the
yes, yes.
past, does that affect the if they decide to go for IVF treatments, so does that
Mm-hmm.
factor affects that process?
Yes, that history of recurrent miscarriages is very important before we go for the process of IVF, because we need to completely examine the couple, the reasons for that recurrent miscarriages. So if there is a like whatever miscarriages they have undergone, and if they have previous physicians or the doctors have gone for a testing of the products which have come out after the it depends upon at which stage the miscarriage happened. Supposing it's at 6, 9, or 10 weeks, then we need to get the karyotyping of the fetus also, or the parts of the that products of conception also. So that gives us an idea in which direction to move. Was the embryo itself not healthy to sustain a life further, or there was some other factor which was causing that miscarriage. So it is important right from the uterine factors, as in if there are some septums in the uterus, if there is some fibroid which is not letting the baby get its proper nourishment from the mother, or there was a lot of adenomyosis or swelling in the uterus due to which the baby was not able to get proper blood supply from the mother, or the lining was not good, endometrial thickness was not fine, there was Asherman's, or any other factor. So you have to find out the reason. The reason starts from the uterine factor, as I told you. It can be from the ovarian factors also. Your ovarian quality may not be good. You have a low reserve, then obviously it implies that the oocyte quality will not be good in that case. So that may also give rise to a miscarriage. Or if you have some tubal factors, first of all, there won't be any pregnancy. But if there are tubal factors and you have got a hydrosalpinx, in any way, if you conceive from the opposite side, that embryotoxic fluid will definitely not get that baby grow. So this could also be the reason. Apart from that, there are other factors, as in I told in the earlier sessions also. You may have some immunological factor also. Your body may not be accepting some embryo which has come from outside. So we have to think from that point of view also. Along with that, your husband's factors are also important. How the semen parameters are, what is the count, what is the motility, how is the morphology, or if there are any chromosomal abnormalities in the husband. So all these factors, we first go for in-depth examination of everything. And in case we find everything is fine, there is no other reason, there is no other factor, then yes, we can advise that couple to go for the biopsy from the embryo we form in the process of IVF, and we go for the transfer of only healthy embryos in that case. So these kind of couples can be helped in this way, and they have to be taken for the process of IVF after complete examination, after detailed extensive examination of both the parties.
Okay, also like male fertility is not a very talked about topic. If you see, like, a lot of people, if they're having any fertility issues, they just go for the women to have checkups and everything. So, is there any signs or symptoms or any way where you can self-examine and then you can actually find out, that we both need to go for a checkup or something? Like for women, we can have the lifestyle issues, but if you see, men can also have lifestyle issues, right? The stress is also there, the
I
overworkload,
completely
the
cannot
sleep.
make I completely
I'm
cannot
talking
make out, Nikita. There is some
one
severe
second.
network issue from your side, it seems. Are you asking me some self-examination points
Yeah, I'm talking about self-examination for male
before a
infertility,
couple? Yes, yes, yes. See,
specifically
before
males.
you
For
seek
yeah.
any expert advice, yes, before you seek any adverse expert advice, there are multiple things available on internet also. And these days the couples are also well aware of everything happening around them. So in that case, see, the age factor is definitely very important. Okay, so you have, because we are having late marriages these days, so everybody has to be sensitized regarding this point, that if you are going to get into a marital relationship later on, then you either go for the preservation of your fertility in any form. If you have a partner which is decided, you can go for a frozen embryos, and you can always plan your pregnancy later on. But in case you have still not you're still not decided whether you want to get married, or you don't want to get married, so in that case we suggest that yes, you should go for age factor. Your age factor is important. So the female should go, get them examined, and if they prefer to preserve their fertility, they should go for freezing of their oocytes at least. Okay, so this point is very important, because many couples come to us at 37, 38 years of age, and then they ask that now we want to plan a pregnancy. So that time, obviously, naturally also your fertility status is declined. So if you're not if you're not decided about getting your family, starting your family, then you should plan this out at least at the earlier stage only, so that you are not advanced, you're not into an advanced age, so that the success rate itself goes down at that time. Okay, so if you're asking about self-examination, then yes, the first checkpoint would be your age factor. Get an ultrasound done, get a serum image at least done to get. If everything is fine, you can wait. There is no problem. There is no hurry in that. But yes, if there is some issues, there is some problem, you should seek an expert advised, and you should definitely move forward in the direction.
Okay. Also, ma'am, gynec issues like, can you hear me now? Can you hear me, ma'am?
I think we don't have any more questions coming up here.
There are questions. One
There.
second.
Mm. There's one question: what is IVF and who are the couples who need IVF? See, Mr. Victor, it's very important. I just told you about IVF process. It's in vitro fertilization, in which the eggs and sperms are mixed outside the human body after preparation, and then they are transferred into the female uterus. You can go back to this the session and you can see the answers. And who are the couples who need IVF? For this. For this, we need to see the reasons of getting into IVF. See, the causes may be very varying from the ovarian factors. Like if the ovaries are not producing enough number of eggs, then in that case, this couple needs to go for the process of IVF. Or if the egg quantity is too much, if the that we call these cases we call as PCOS. In these cases, we have a lot of eggs in the body, but they don't mature. They don't mature, and the patients may have periods in a duration of 2 to 3 months. So they don't have, that's normal cyclical maturation of the eggs, which is usually found in the females. So these patients can go for the process of IVF, where we can help them by getting the eggs mature, by getting the eggs from their body, maturing them, getting the eggs out, and fertilizing them outside the body. So they can be helped. If your test reports say that you have blocked fallopian tubes, or there is some damage, or there is some history of in case you have already had pregnancies, you had already had babies, and there was some mishap, you underwent a tubal ligation, and you want to get another baby because of some problem, then in that case you qualify for a process of IVF. You have some problems in the semen parameters of your partner. If the semen is not good enough, the count is very less, the motility is very less, in that case you should go for the process of IVF. Apart from this, from the female side, if you have endometriosis, and that endometriosis has done severe damage to your tubal architecture, your tubal and ovarian architecture, in that case, yes, you should definitely go for the process. That will definitely help you. I also want to know if the process is painful. This is definitely a very important question which we get when the patients come to us for the very first time. The process is not at all a painful process. It is just the minor shots of injections which are given on your tummy, and your IM injections, which may be slightly painful if you can tolerate that much pain. This process is completely an elective procedure, a daycare procedure. You don't need to get admitted to the hospital during any of the procedures we do, neither for hysteroscopies. You have to come to the OPD, you get your procedure done, and you can go back. So, as per me, this is not at all a painful one. But yes, there we have seen cases where the pain threshold is very less. Some of the patients, they come and ask, I am very scared of injections. If you fall in that category, yes, of course, it may be painful to you, but actually speaking, this is not. This is a well tolerable process, and people can go for it. There is no problem. I think we have this many questions only.
Yes, ma'am. We
If
are
you
done
have
with the
more,
questions.
if you have any more questions, you can always come and in the links given, you can ask us the questions and the topics you want to go in the future also. Then we can come up with the topics of your choice, and you can ask us a question. There's one question, I think. One somebody has asked a question: what is the difference between normal pregnancy and IVF pregnancy? See, Neelam, it's a very, this was a very big myth earlier that the IVF babies have got, they're different from the normal babies. It is the process of IVF is not, doing something different. It is just your own gametes and your own eggs and your husband's sperm, which are cultured outside the body. That is the only difference which is there. Okay, once they are cultured outside the human body and they are transferred into the uterus, they grow like a natural pregnancy only. Like you have a natural pregnancy which is formed in the tubes and it comes to your uterus. So in this case, only the part of fertilization is done outside, and the growth of 5 or 6 days is done outside the human body. Rest all is done inside the human body. So after IVF came into advent, we have seen now more than 1 lakh, I mean, there are millions of babies which are there. uh, IVF babies are there. So you see that the babies are completely different. In fact, few studies show that the IVF babies are more active, because you have taken good number of prenatals and good number of multivitamins, and you have taken good care of them. So these babies are more active than the normal conception babies. So I would say that yes, they are completely normal. You don't have to worry about that. The process is completely any complication free. No worries about that. So with this, we come to the end of this topic. More questions will be welcomed, definitely. You can ask us for any topics. Like I told you, we will be happy to serve you. We will be happy to answer those questions in the subsequent session. Thank you so much, Nikita, for carrying out this session.
Thank you so much, ma'am, for this wonderful session. Thank you. Thank you.